clinic and a surrogacy agency in Mexico. We've been doing IVF for around 6-8 years. We have quite some clinics in Mexico. We are really a small agency. We don't take more than 10 surrogacy clients a month, and that's the way that we want to stay. We don't do conferences. This is our first. And we're doing it because we recently had quite a few Israeli clients, so we thought that this could be like an appealing option that some clients don't know about, the Mexican option. This is our team of doctors. We have a very, very nice clinic set in Mexico City where we have our IVF lab, but we have a number of other clinics in Mexico. We've been doing IVF for quite some time. We hope to still do it. So the surrogacy part of our clinic is one of our most important programs, but we've been doing this for a while. We didn't open our doors just to do surrogacy. We do surrogacy with our local egg donors, and we also handle international egg donors. Not through us, but through external companies that also have Jewish egg donors or fully Caucasian egg donors. This is our lab. It is one of the best setup labs in Latin America. We're certified by the Mexican and the international fertility centers. We do normal ICSI when we do surrogacy. We have a very nice set of local donors, which we screen personally. We have a very nice surrogacy program, which we're very proud of. Our surrogates have to be enrolled in a nonprofit organization that we opened. They have to be enrolled in quite a few programs. We saw that surrogacy in Mexico was growing, but these were women that probably after the last payment, 2 weeks from then, they didn't have any other money. These are all single mothers, probably 2 to 3 children. So we saw that even they had that money when they finished the surrogacy process, they didn't know really how to invest it or make the most out of it. So all our surrogates are enrolled in a program that handles some auto-employment options, empowerment workshops. We help them get childcare for the children to start for them, just making more of that opportunity that they have. We don't advertise for surrogates. All of our surrogates, since we have a small and very well taken care of program, are neighbors, cousins, sisters. We have had surrogates, aunts and nieces, quite some sisters now. So that really is nice to us because they really trust in the program and we keep it very close. All of our surrogates have to be between 20 and 28, but we have other surrogates older than that. These are some of the babies that have been born through us. These are some Israeli clients that have been with us. So our program cost is $47,000 with a local elite egg donor. Elite means that she's, whether it's Spanish, American, Canadian ascendants, they have university degrees, completely healthy and proven donors. That's our local elite egg donor. If you want international egg donor, then the cost is $44,000, which is the same cost, just removing the egg donor compensation, and we can put you in contact with other international egg donor agencies that we work with, so you can find a suitable egg donor. We have a very nice success rate, which we're very proud of, and most of all, since we keep it small, all my clients have my WhatsApp, my email, my phone number. We are not looking at having hundreds of clients. I couldn't handle that. And that's really good to us because I I get in touch to check on how their donor is doing, how the surrogate is doing. They get personal updates from me. I work 24/7 every day, so they are sure that even if it's a holiday or a weekend, they will get their update to the process, which is very important, especially in the first stages where it's kind of abstract. You just paid some money, but you don't see anything happening yet. All the medical checkups also go through me. I translate all the documents so that you're always certain of what's going on in the process. Overall, that's us. We have our office in Mexico City where we do all the IVF process until the embryo transfer. But our surrogates live in the state of Tabasco, which is an hour from Mexico City. Surrogacy is legal in Mexico in the state of Tabasco. For same-sex couples, only the genetic father appears in the birth certificate, in both the delivery certificate and the birth certificate. Both parents, genetic and the partner, can be in the delivery room when the baby's born. They can stay the night in the hospital and the baby doesn't separate from the parents from the beginning. Baby is a Mexican citizen, so he's awarded with Mexican passport also. That has worked for us for many nationalities where their process of adoption takes a longer time. They can get the baby out of the country with Mexican passport. So I think Mexico is really a window of opportunity. I would warn you to be very careful of new agencies, especially, or clinics that have opened, especially after Thailand closed up. Even if you don't contract with us, if you want any other information about legal or medical stuff in Mexico, you're free to ask me. I'll be speaking in a panel tomorrow about Mexico. And I think it's quite a good option regarding great facilities, great surrogates, women that are really committed to the process, great egg donors with a great success rate, good weather. The clinic is very close to all the embassies, so in a very safe area. Surrogates are very well taken care of. We don't do surrogate housing. Most of our surrogates, all of our surrogates need to have a previous pregnancy in the past 5 years, so that means they have babies. We want them to have a normal life. And, we're very proud of our program, and if you have any questions or anything at all, then I'll be glad to help.
What information do parents get about the donors?
About the donors, you get the basics like age, height, weight, etc. We run all the full serology, HIV, hepatitis, all infectious diseases that could go through the baby. We run a basic genetic testing also to check for any risk of diseases that could be transferred to the baby. Nutritional evaluation.
Additional genetic testing, can that be done? Specific illnesses?
Yeah, we can do that. We have had clients from the US especially that want to search for something specifically. We can do that. We also do PGD for those clients that want to do PGD or that have high risk because of their age. We normally do ICSI in all of our procedures. We don't do IVF. We do IVF only with those eggs that are not mature enough to leave them naturally to see if they fertilize. What else?
Can someone meet the egg donor?
No, in Mexico, egg donation is confidential. So they don't have your personal information and you don't have the personal information of the donor. You get all the basic information, but you don't meet personally.
You get to see the pictures?
Yeah, you get to see the pictures. What happens in the Mexican case?
Besides the picture?
Yeah.
Other details?
Yeah, a profile that has personality information, whether they do exercise, what kind of activity they do, artistic abilities, things like that, something that they write about themselves, the psychological evaluation. We run some tests, you get the results from that, from the psychology. You can also talk to the psychologist about your specific donor. What we do is that you feel a format where you state what kind of donor you want, and then we cross that with our egg donor bank and just send you out the profiles that match your criteria. It's not as in the US where you enter a web page and you can see all sorts. So we only send a few profiles that are not only the ones that match your criteria, but also proven donors that have already resulted in pregnancies. Because of the expense that surrogacy represents, we only want you to work with proven egg donors so that we have a best chance that it works out.
And on average, how many embryo transfers would a couple need for pregnancy and birth?
When we do ICSI and a young, healthy, proven egg donor, we have around 75% success rate right now on the first transfer, which is really high for us, which is really, really good. We're very proud of it.
What was the biggest number of attempts that anyone had to do?
Not more than 3, never more than 3. Usually in the worst case, it's 3 embryo transfers. And usually that happens not with gay couples but with heterosexual couples that want to go with their own eggs. That's the hardest case. But when we go with egg donor, it usually works out on the first or the second try.
Do you have any secure program, like besides your basic program, maybe at home program, like other agencies?
Do we work with other agencies?
Cycles.
Meaning that a fixed price that would take all the risks from the intended parents, that they pay a bit more, but they would
after the first attempt, if it doesn't work, the second attempt costs around $4,000 because you already have a contract with your surrogate, and considering that you have frozen embryos. These costs, the $47,000, includes the freezing of whatever embryos are left in the process. So if you go for a second transfer, it's around $4,000 what you have to pay, which is just the frozen transfer and the transport of your surrogate from Tabasco to Mexico City, hotel expenses, and then back, which is really one of the lowest prices for second attempts in Mexico.
And what can you tell us about insurance coverage in Mexico?
I would warn you to not trust any agency that tells you that there is medical insurance in Mexico. There is mandatory medical insurance from the government for every citizen, like the Social Security. So all of our surrogates have the official government medical insurance, which means that if something would happen in the process of the pregnancy, she would have to attend any public facility to be for medical attention. But there is no private health insurance for surrogacy in Mexico. In Mexico, health insurance to cover pregnancy starts 10 months from the minute that you contracted the insurance, so it doesn't cover a surrogate. And by Mexican law, if you're deliberately insuring a woman that you're deliberately trying to get pregnant, it will be considered as fraud. But I know of many agencies in Mexico that would charge a client $4,000, $5,000 more, saying that they can give medical insurance. What I guess they do is if they have 10, 50 clients, they get that money, and that just, it's like their insurance, but it's not legal to do it in Mexico.
So what happens if something happens to the baby or the mother during birth?
Premature birth. She will have the right to a public facility, but that is a choice of the parent. If the parent wants to go to a private facility, then we would recommend. Of course, the prices in Mexico for private facilities regarding medical expenses are not as expensive as anywhere else. That's a big advantage.
So actually you say if one gets insurance for this procedure in Mexico, you have to pay for the clinic.
Not just us. We would give a list of medical providers that you can choose from, especially because our doctors are specialized in these. But if she would need another specialist, you would need to contract another hospital provider.
More about the hospitalization for premature babies. If they are born week 30 and they need to be hospitalized for 2 months in the NICU, what would be the expected costs? Because in the United States, it can be, around $1 million.
Yeah, a night in the NICU can be cost around from $250 to $1,500, which is really low compared to the US. Of course, if it's a high-risk pregnancy, for example, triplets, then you would be looking at the last month or so for them to be in a NICU.
Okay, that's it.
Okay. Well, that's it. I'll be downstairs. And thank you.